Absolutely.
Thank you.
Mr. Chairman, ladies and gentlemen, thank you very much for giving us the opportunity, and thank the society for us to be able to provide the society with our immediate and long-term outcome with patients at our institution that undergo a single-stage hybrid revascularization. This is my following disclosure. So the objective of this study was to demonstrate that robotic-assisted simultaneous hybrid revascularization is safe and feasible alternative treatment of multivessel coronary disease in selected patient population. Again, I said this is for selected patients who are deemed suitable by our heart team. Our methods was we did a robotic-assisted LITA to LAD, and for our anticoagulation method, we used a thrombin inhibitor called bivalirudin. The room was reset for cardiac catheterization. LITA graft was checked immediately, making sure there's LITA patency, and then PCI using bivalirudin was performed of the vessels, followed by clopidogrel that was given 600 milligrams via a nasogastric tube. And 2 hours after the administration of the clopidogrel, bivalirudin was discontinued. So from 2004 to 2013, 146 patients underwent hybrid revascularization. 38 were two-stage, 108 with one stage, of which 78 were males. Mean age was 61, and the age range was between 33 years old to 90 years old. This is patients' demographics in terms of their LV grade. Most were, I guess, LV grade 1 and 2, as you can see, and most were elective cases. Because of bivalirudin is primarily degraded by the kidneys, these patients all had very good renal function. The CCS class all within were a CCS class 3, 4A, and as you can see, most of them had relatively very low morbidities at this stage. The pre-op coronary anatomy, 9 were left main, 91 were 2-vessel disease, and 8 were 3-vessel disease. Intraop PCI of the following vessels were performed: 50 to the right coronary artery, 21 to the diagonal, and 47 to the circumflex. All patients underwent transit time Dopplers, which all revealed a median of around 26 cc's per minute. All anastomoses were done in the beating heart, and intraoperative angiography was performed on all patients. In terms of postoperative complications, atrial fibrillation was only 8%. One patient had a perioperative myocardial infarction. One patient, interestingly, had left kind of a spatial neglect, which improved. We thought most likely that was an embolus that occurred during the catheterization. And 24-hour blood loss was a median of 500 cc's. The angiographic patency, as you can see, immediately intraoperatively with 100% angiographic patency, and then at 6 months, 94%. These patients were then brought back and follow-up up to 9 years so far. All patients were CCS class 0. One was in NYHA 1, for which was found to have an occluded DES stent, for which we underwent, again, revascularization. In terms of our stents, it was a 92% stent patency. From 9 stents that had stent complication, 7 had further reintervention with another stent. Long-term follow-up of 5 years. Thus far, we've looked at 69 patients. Patency rate of the LITA continues to stay 94%, and for the stent, 92%. Length of stay of the patients generally is about 3 days. And we've now designed an ultra-fast track for our hybrid group. 24 patients have been done, where they avoid the ICU and they get discharged second or third postoperative day. Overall, in conclusion, robotic-assisted one-stage hybrid revascularization is a safe and feasible approach for selected patients with multi-vessel coronary disease. Immediate and long-term patency results thus far are compatible with conventional revascularization, and it has an advantage of reducing these following morbidities, such as sternal bone complication, infection, neurological complication, and specifically a much quicker return to work. Randomized trials are extremely essential for us to further evaluate the true impact of this technology. Thank you very much.